You're listening to the Physio Matters podcast in association with Choose Health, and this is session 32. Welcome back to the Physio Matters podcast. I'm Jack Chew, and I'm delighted today to bring you our Olympic special, session 32, launched for our patrons on Friday for the Olympic opening ceremony, and for the rest of you today on Sunday. And we are underway with the Olympic Games in Rio, and today we bring you triathlon physio Paul Westwood and elite performance coach Joel Filliol, who has several athletes performing in the triathlon at the Olympic Games, and we know that they are considered mavericks in their field by keeping it simple and progressing load without tinkering too much with biomechanical things, gadgets and gizmos, and are renowned for doing so and renowned for getting results. It is unbelievable that we've managed to get them both on the podcast, especially considering that this was recorded in the immediate run-up to the games. So delighted to do that and to bring that to you. Thank you so much for all the feedback that we got for the last episode with Mick Thacker, which part 2 is coming next month. And part 2 includes a lot of answers to questions that were posed on Twitter, burning from the first episode, which is brilliant. If you have any more questions and you want to try and catch us out, if there's any questions that you're asking on social media that don't come up in the already pre-recorded session 2, then please speak up and we'll try and get hold of Mick to record some more goodies for you. Please join us on Patreon. We're doing essentially a crowdfunding to try and keep Physio Matters fan-funded and avoid adverts within the podcast. So please join us on patreon.com and search the Physio Matters podcast, which is Patreon. Several of you have done so already, and so we've been pushing some exclusive content, some offcuts, not outtakes, but other questions that were asked to our guests and other little scenarios we've had when we've been in IFOMT. So recently we put the recorder onto a table with Derek Griffin, Mary O'Keefe, John Hurley and Rob Tyre discussing things at IFOMT on a pub table. So record really raw footage of 4 top names just chewing the fat over things, and we put that out just exclusively to our patrons. So stuff like that's going to go out on a regular basis. So if you're craving some more content from us and you want to critically think about the things that you're doing in and out of clinic, then please do consider supporting us and we'll support you back. But without further ado, let's get you on with session 32, our Olympic special with Paul Westwood and Joel Filliol. I'll see you at the other side. Okay, I'm delighted to bring back a ex-guest and introduce a new one for you all. We have Paul Westwood, aka Westy. You will recognise him from Physio Matters 11, I think it was, the now infamous K-tape debate with Paul Coker, in which they hashed it out over tape. But we said at the time, and we have taken a while getting there, but there's a lot more to Paul than just a tape skeptic. So we're delighted to have Paul on the show. And with him, we're amongst sport coach royalty. It's not quite Sir Alex Ferguson, but not in my eyes, not far from it. It's Joel Filliol, the infamous Canadian coach, and hopefully we'll see why infamous in this conversation. So thank you, gents, for coming on the show.
Yeah, thanks for the invitation, Jack.
No bother, guys. Right, so we'll I don't know which order to do this for, but I've done my best to bundle a cryptic introduction to each of you, but we'll do that first. So Paul, can you reacquaint the listeners with yourself? Tell them what you've been doing before and also since the last podcast.
Okay, yes. So, physio, born and bred in Birmingham, qualified way time ago in '98. Did a couple of years in the NHS, then swiftly emigrated off to New Zealand, where I've spent most of my career, mainly in private practice, sports academy, sports clubs, and work assessment, that kind of thing. Running concurrently alongside that was my sort of like amateur sort of like triathlon career and triathlon coaching. Brought me back to Europe that was about 5 years ago now, where I was doing a bit of racing in Germany. Also hooked up with a few other pro triathletes, ended up working for the Danish national triathlon squad as a physio. which ultimately led me to working with Joel.
I don't recall that.
And his team of international triathletes there.
Right, now, as per the last time we had this chat on air, you completely downplay your own athletic prowess, and so you're fairly well qualified as an athlete as well as a physio. Is that reasonable for me to say?
Yeah, well, I started doing triathlon when I was back at university 20 years ago, doing it at an age group sort of level, competed for GB age group, then also when I went to New Zealand, I would finish kind of like top 10 sometimes in an Ironman, so I sort of like got my, my first, or one of my Ironman I did, I was 6th as an age group as an amateur, so I walked away with a plastic trophy as opposed to like $2,000, whatever it would have been. So from that day on, I thought, I'll enter the pro ranks and got a few top 10s and stuff like that. I was never really a pro. I was always working as well, doing other stuff. But yeah, top athlete. I'm still don't do as much triathlon anymore, but I still cycle, ride my bike. I still got to be competitive, and for me, with my profession, like with my role, I see myself as N equals 1 study, and so I always want to see what happens when I do practice what I preach, and see what happens to the human body when you do athletics.
Absolutely. No, it sounds like a pretty reasonable way to go about things in terms of practicing what you preach, certainly, and I think it's something that there's an awful lot of competitive physios out there, increasing a worrying amount that aren't as well creeping in there, so we'll talk about that, I'm sure. But let's then move on to Joel. I mean, I can imagine I could let you just riff on this for a good hour. You've got an extensive CV, so if is there any chance you could just let us know, give us a bit of your background, if you don't mind, mate?
Sure. Former Canadian, trying to be Scottish now. Now I'm living in Glasgow, but I started in triathlon in Canada. I was an athlete, not as good as Paul, but I figured out I should get into coaching pretty early on, and just had a lot of doors open for me along the way. I was lucky enough to develop in Victoria and British Columbia, really alongside and just after Simon Whitfield won the gold medal in Sydney. And one thing led to another. I became the national coach from 2005 to 8. Where Simon won another medal in Beijing, and then needed a change, went over to the UK and was head coach for British Triathlon for a couple of years, but I figured out that I didn't really want to be a manager at that stage in my career. It was kind of a non-coaching role, and I figured actually my best use in sport and my skills needed to work directly with athletes. So then I went off and doing that as an independent coach, and that's what I'm doing now. Is we've got a squad of athletes from a number of different countries, and we operate our own performance environment. And really, that's where we hire Paul to work with us, and we take the best elements of what we think leads to success, and with no kind of politics involved, we can really create our own best environment. So kind of a self learner along the way. I didn't finish my degree in uni. I did a couple of years of kinesiology in Canada, but otherwise I've been kind of self-taught through all of this, and variety of different coaching courses, etc. But really don't fit into the mold of how I would describe how I got here, or how I would tell somebody else how to do it. But fortunate enough to work with some really outstanding athletes, and really have learned from them along the way. And now we're just in the last month. I suppose it's about a month before our races in Rio. Although from talking to Paul, for us, the games aren't the only thing. We like to have lots of different goals, but we do have 9 athletes that we're preparing from our group for the Rio Games.
Fantastic. Now, I think that is hopefully something we can come back to a little bit about the purity and unpolitical nature of that setup that you've got there. We'll see where the conversation goes, because we might touch on it naturally, but we've got a few bits and pieces that we need to chat about. And the reason this conversation came off is because of certain things that me and Paul have in common over a beer, as well as things that he then immediately referenced to your sort of situation. So I hope you don't mind me throwing something at you to run with for a while. But having followed your work for some time and had the benefit of insight from Paul, I feel compelled to ask whether, in your opinion, physiotherapy is a force for good or bad in elite sport.
Yeah, it's a good question. I mean, I suppose initially I think, well, what do you need to be successful in sport? And, certainly you need great athletes, you need good coaches in leadership, and you need good medical support. And physiotherapy should be part of that. In fact, we elect to invest in that in my own environment. As we said, with Paul and others, we choose to spend our money on physiotherapy. However, on the whole, when I think of it in the big picture, I think, well, what is the actual, impact here? And I think actually often it's neutral and sometimes bad. So I think it's as much in relation to how rare good coaches and good athletes are, that good physios are rare, and particularly ones that know how to work in an elite sport environment. And perhaps what might make it different. So I guess I see all are not equal. It's like anything. You get a little bit of knowledge from school, and then you've got to actually learn how to, or book knowledge, you've got to actually learn how to apply that, and what's useful and what's not, and how to work with people. I often think, again, like our injury rates in elite sport going down. The kind of the questions I ask. You certainly see this. It's really interesting to watch. Environments where money is no object, and that might lead us to Premier League football or other professional sports, and you just see catastrophic injury rates, and you think, how can that be? How is that? When you've got no limits on what you can spend, on the people that you can find, on the tools and toys that you can use, that we still have these huge injury rates. And why is that the case? And coming back to my own environment, what I've seen over my career in sport, and is that not all physios are created equal, and some are at best neutral, and some are really actually outright bad in terms of their impact on athletes and what they think, and therefore we got to choose carefully, and I suppose really on a bigger picture, think about how we're doing physiotherapy and how it's integrated into sport. And that was one thing that, when I started working with Paul, that we were able to find a way to integrate it holistically with what we're doing. It's got to be connected to psychology. It's got to be connected to the training. It's got to be connected to belief. And all those things have to fit together. And I think sometimes when physiotherapy goes bad, it's compartmentalized in one area that's not connected to the rest. And certainly that's a big part of my coaching practice is working with our team to integrate everything, that that athletes don't get negative beliefs in their mind about what they can do, whether they can heal themselves, or what causes injuries, or even dependence on particular interventions and tools. So I think all together, the profession probably has some tough questions to ask itself. And I think there is a way that great physios do figure out how to work with athletes and coaches and really make a positive impact in elite sport.
Cool. Well, I mean that's given an immediate insight, but for the listeners there, I mean, I think one thing worth mentioning on that is we do have some serious questions to ask the profession, and we try to, and that's what we're trying to do. And I think that it's really important that the profession recognises that it's not just us asking ourselves questions, it's other professions and other coaches such as yourself that are looking on and having a perception that whilst recognising there's good ones out there, if the majority are doing some, we could say harm in a lot of ways to performance at the least and health at the worst, then really there is a lot to be talked about. Before I bring you in, Paul, just Joel, if I can just expand on that a little, is the when I think about you mentioned about physios having a compatible nature within within the elite sport environment. Now, immediately I'm sort of wondering, I know some brilliant elite sport physios and some that work well within that system that you're describing holistically, but also I've almost got two brands of those that aren't so good, and one is one that just panders to the system and does what they need to, and so they don't really add much or take anything away. Now, they tend to be people that are compatible to some extent within the systems that exist, so they function quite well. And then there's the other that are almost a bit snotty and over-medicalise things and don't quite offer the scope or the parameters in which real, true, successful coaching can exist, and the gritty nature of the things you have to do to your body to really achieve. Now, I promise I'm not trying to put words in any mouth there, but I've almost there's a two bads there, but one is actually compatible. So I just wondered, do you relate to either of those sort of analogies I've used there, and if which of those have you encountered maybe?
Definitely both. I mean, for me, some more negative experiences with physios are ones that probably rate their importance as higher than reality and really try to perhaps they don't set out to create a dependence, but the way of behavior sometimes leads to that, which can be destructive, particularly with environments that don't have access, they don't have daily access to therapists. We want them to get better, and I think that the athletes to get better, and that's the point. And certainly there are ones that, again, the feeling is that they want their word or opinion to be the strongest. And I mean, we see that kind of perhaps culturally with medical practitioners tend to have high authority, and often, perhaps as much with doctors, but that they tend to think that their opinion is the most important, where in a sporting context it's not actually always the case, because they may not have the full context of what does it mean. If an athlete's got some sort of injury issue, the way that you talk about that, or the information that you may not know as a physio, or they may not take into consideration, can be really important. And the examples are, physios that, tell an athlete what they can and can't do, which sometimes may be true, but the way that you go about that is actually really important, and it can create either a negative belief within the athlete, or even a dismissive kind of belief that this isn't actually an issue and you can just train through this particular niggle or pain, when actually the coach may not believe the same thing. And typically, again, the coach as a manager of the athlete's team is ultimately responsible for pulling all the pieces together. So physio doesn't always have that perspective. It depends how involved they are. When we're working with Paul, he's there every day. He sees training sessions. He sees everything. So that's perhaps different than going into a clinic a couple times a week and seeing somebody who may not have that perspective. So, so I think, again, coming back to your question, like the negative ones are ones that I think want to make interventions sometimes for the sake of interventions, or sometimes interventions that appear to be sophisticated when they may not actually be necessary. The other side of that is ones that sort of fit into the sporting system, as you say, and they can be compatible with this system in terms of the way that the system likes to work, but that doesn't also mean that they're effective. We see a lot of kind of bureaucratic thinking in sport nowadays, Olympic sport, and in the way that these organizations work. And there's kind of a lot of I could see even with some of the younger physios that maybe we're working through EIS, etc. They kind of have like a 9-to-5 attitude, where they sort of put in their time, they tick the boxes, and away they go, and not really connecting that, again, the job is to get the athlete moving forward, is to keep them healthy, is to enhance their performance, all those things, and that doesn't necessarily fit into those boxes, even though that may be fitting in with the system, as it were. So I think there's pros and cons to both of those, but I do see how they're not always helped by that system. And certainly I remember working with British Triathlon, how we would sometimes be frustrated with the constraints that we would get with for example, EIS provided physio. They could be very good, but we also have to deal with this way of working that may not actually be kind of what I would describe, what Paul would think as what it takes. What does it take to be very successful in elite sport? So you got to think a little bit differently, and you got to try to see the whole picture. And one of the things I think that makes Paul a good physio is also thinking like a coach, and thinking like you're trying to coach the athlete in a way. Of course, it's from your own angle, but it's still coaching, and all that means is how do you deal with the personality? How do you deal with the person to help them get better?
For sure. Now that's perfect segue into bringing Paul in then. Paul, as long as you're still there, pal, I wanted to just see what your take on those couple of questions on, and as well as just I want you, if you can, to touch on some of the. Can we put some meat on the bones of what these interventions might be that Joel might be alluding to?
Yeah, I mean, going on interventions, and Joel would agree with me. There's this need in physiotherapy that to be actually doing something, you need to intervene. If an athlete comes up to you and says after a track session or during a track session and say, "Oh, my lower leg is hurting a bit," the natural reaction of a lot of physios is, "I need to do something." If an athlete might, "Do you want me to put ice on it?" That's what the last physio did. This constant need, and it's a lot more healthier and positively more adaptive if you just, knowing that athletes, you say, well, no, that's just probably a training response. That's fine. Back up if you need to, but we don't need to pay attention to that pain and make that an issue by having an intervention. And I qualified in 98. The first 5 to 10 years of my career, Maitland trained, then Mackenzie. I was basically disappointed with my profession. I didn't see that it was really making much of a difference. I went to New Zealand then, and applied thousands of acupuncture needles to many different people, and some got better, some didn't, but there was no rhyme or reason for it really. So from then on, I thought, now there has to be a reason why these people have pain, why some people get better, why others don't get better. Going back to my best race that I did in Ironman, I remember 2 weeks build-up, I had Achilles pain, I couldn't run, there was thickening around the tendon, and, I almost nearly had acupuncture on it, I was that desperate, but I did the race. I didn't have acupuncture. I did the race, and it was one of my best results ever. Finished 6th, ran a blinder, no pain or anything. The Achilles was fine. So, and then, I just went on an exploratory path really to try and find out why people have pain, what makes people different, and that developed into this, what we would now say is the biopsychosocial approach, linked in with the coaching I was doing because, I wanted to know how I could perform myself, how my athletes could perform well. And, I was eventually I came to believe that it's not just about, the blood and the muscles. It's the mind and the person that matters, as well. I mean, when I'm working with Joel, your average day, we would get up with the athletes, go down to the pool, they'd do a 4 or 5K session. And that's when, even just walking to to get the coach down to the pool, that's when I start my physiotherapy assessment and treatment. I see physiotherapy as really observing behavior, whether that be movement behavior, communication, language, non-verbal communication. So I'm observing all those athletes all the time, because that will then fill in the picture if that athlete comes up to me later in the day and says they've got some issue with pain or whatever that might be. Me and Joel will then sit at the side of the pool and, we'll talk about each athlete individually, how they're doing, what have they said, all these kind of things. And that's what builds up this, as Joel says, this holistic holistic approach to management. Then the guys will do their swim session. They'll go for a bike. Then they'll go for a run. I might go for a run with them as well. Then I can again spend that one-on-one time with them if necessary.
I mean, I'm really tempted to just jump in. I now want to ask you the same question I opened with to Joel: is do you think physiotherapy is a force for good or bad in elite sport? And because I don't mean in this question what it can be. I think we can always say that, right? Well, of course it can be and it should be, but is it as it stands?
Well, that's it. I just described how it can be a force for good, but I mean, yes, definitely it can be a force for evil. And I seem to spend my days as a physio sort of like trying to undo, and certainly in working with Joel, you're there trying to undo the beliefs and behaviour of athletes that have been ingrained and instilled in them from other physios. I remember seeing this athlete and asked, "Can I see you squat?" They didn't do anything. They just said, "You're just going to criticise me. I've got a rubbish squat." This. And this was a runner. She hadn't run for months. She was, struggling in this chronic pain cycle. And it all came out that, she'd been working with physios, strength and conditioners. And she had such a negative belief about her ability. And, this was, I can't remember what even was wrong with her, but she just, it had nothing to do with really how she was squatting. That's an example. I'll go to the strength and conditioning gym, see a number of athletes, doing their strength and conditioning. The ones that I think are in a good place are the ones who just, go in, do their 10 or 20 minutes, and then they're just out the door. The ones that are in there and have got these huge exercise programs, they're in there, that becomes a main focus for their, part of their sport. They're the ones that I would, yellow flag. I would be worried about those ones that spend too much time in the gym, because a lot of the time they will be doing that because of fear.
So it's out of obligation. They're not in there enjoying it necessarily.
I think they enjoy it because it fulfills their need. They have been told or developed the belief that if they don't do all these exercise, then that pain they had before will start again, or they will get injured again. So therefore, they have to do all these exercises religiously in order to prevent that. Whereas an athlete with a healthy mindset believes about themselves, believes in their ability, will do stuff in the gym, but it's fairly minimal. Joel can talk to you about what goes on in his with his athletes as regards to strength and conditioning, but it is fairly minimal. Triathletes can't do much strength and conditioning, so I see it with regards to a triathlete. I see one that is doing too much strength and conditioning. There's other issues going on.
Yeah, I will think we will definitely touch on some of the strength and conditioning features of Joel's team. Paul, if I stick with you for a second, what factors do you feel heavily influence an athlete's sense of fragility? I know that's something we talked about at length in the last podcast you were on, and you'll have noticed it being brought up since, because you're a trendsetter, as we know, on physio matters. So, what's your take on that?
Fear of their movement, fear of their body, fear of their way they do things, fear that they're weak, that they haven't got a strong enough core, because they've been told that unless they have a strong enough core and unless they can squat like this, then they're likely to get injured. I did a kind of experiment with all the guys from Joel's team, and all their squats were appalling. In fact, the faster runners had the worst squats if you were to do a sort of like a FMS sort of screen. And Joel would agree that what I don't do with his athletes is what he says, tear them apart. because I will observe behaviour, but I will only give information that I think is going to have a positive and positive adaptation to that athlete. Because seeing those athletes there, they were right for the, Mario couldn't even get his heels down when he was squatting, and your traditional sort of way you should do a squat, they would be trying to get his heels down. So I think
with that though, I mean, I can imagine there's our listeners. I keep flattering them in each episode and telling and saying how wise they are. But even some of our listeners would just be screaming down at their own headphones to say, "Well, what if they're squatting wrong?" So I imagine you're not buying the right and wrong normalization process then of human movement. You're open to variety, it seems.
Yeah, totally. Yes, for that particular client group, for these triathletes. Yeah, I mean, if Mario came up to me and said he wanted to, squat, 150 kilos, we might have to work on that a bit. But he's not. I mean, he can barely squat his own body weight. So it's not an issue. And then it just becomes a distraction from what they should be doing. Triathletes should be swim, biking, and running.
I mean, you're an absolute maverick. I love the fact that is actually a pretty outrageous thing to say. It shouldn't be. Joel, to bring you in on that then, anything you want to touch on what Paul said, please do. But otherwise, yeah, what do you feel influences fragility in anything to add?
Yeah, I mean, it's limiting beliefs of what they're capable of, limiting beliefs about, sometimes we get athletes say, well, I get injured frequently. It's like, why is that? It's like, well, they might say, as Paul said, I have a weak core, I have a weak whatever, and often those are beliefs that they've picked up from physios or doctors or other coaches that are limiting, and often they're just not true. They may be injuries are completely unrelated to their biomechanics. Their biomechanics may or may not be limiting, and often I think they're not. I think often what the real problem is that they've basically overloaded themselves. The classic too much, too soon, too often, not enough rest in their essential sort of physical training program has broken something down. There's some tissue that's been overloaded there, and then it's causing pain. But that doesn't mean it's always going to happen, So there's a lot about just basic loading, understanding that, rather than believing that you've got a fundamental biomechanical limitation that has to be continually worked on or developed. I mean, as Paul says, a lot of these athletes, they don't fit into the sort of the traditional way of thinking of an optimal way of movement. And I know, movement is a big buzzword these days in physio and sports, high performance sports in general. And it just really seems kind of like a BS word. Like, what does that actually mean? What is good movement? Or, if as Paul says, Mario's heels can't touch the ground during a squat, and yet he's arguably the best Olympic distance runner that's ever existed in triathlon, maybe it's just not important. Maybe some of these things are just not important, or unrelated to performance, or unrelated to, a pattern of injuries that may or may not happen. And yet we often, if you think of in the traditional model, you go in and you want to change these things, then we run into the sort of the law of unintended consequences, which inevitably, I've seen this so many times, where we look at a way an athlete's moving and they may not actually have any problems, but we try to be clever and we try to optimize, and we end up creating a problem. And it's something maybe we didn't anticipate, because they're, particularly when we're talking elite athletes that have been in the sport a long time, they've been moving a certain way in a long time, very, very difficult to change their biomechanics. And embarking down that road may create a whole host of problems that we couldn't anticipate, and or may or may not even be beneficial, fixing them, if you like, in the traditional sense. So, this coming back to the sense of fragility, well, it's these ingrained beliefs, and where do they come from? They come from all over the place. But, one example that's fresh in my mind was as a bad example of the kind of intervention that you can have is an athlete on the weekend was underperformed in a race. We were in Hamburg, and I had overheard that this athlete underperformed. I mean, they just didn't run fast enough, and this coach told them that maybe they looked like they were limping a little bit. And you just think, we spend so much time trying to convince athletes and that they're okay, that they're strong enough, that they can heal themselves, that they're fine. And yet here was this coach that was like almost trying to implant limiting belief in the athlete. And, not being directly involved, I don't know what happened, but you could just imagine the athlete going away thinking, maybe that's why I didn't perform, because I've got some sort of limp or some sort of injury, and how sort of damaging that could end up being. Just maybe even a throwaway comment that this coach was making could have been just that, like asking the question even. But it shows, how important those kind of questions. And it was shocking to me when I heard this, because I just think this is like the last thing that anybody should be saying, because you don't know what it's going to be that then creates some sort of doubt, that that then the athlete believes, well, maybe there's something wrong with me. Maybe I got to change my training. Maybe I got to change my biomechanics or something like that. Because of course athletes are susceptible to that. They're trying to be the best they can be. They're trying to find answers sometimes, and often the answer is not to intervene and do something. It's to hold the course and let time do its thing, and you get stronger, and things get better, and you go faster. But these kind of beliefs then affect their sense of fragility and what they're capable of. So even just the words can have a huge impact.
I did learn working with Joel is we would be there with the athletes after a race, and some of the athletes would inevitably have a bad race now and again, and it's so tempting then to look at what went wrong and then start to think of, what do we do wrong? What do we need to change in order to, we've got to get better. We've got to do this. And then, but, working with Joel, and it would just be, no, okay, we're just going to get back, training tomorrow, and we're going to carry on with the plan. We're going to keep swim, biking and running. We know that is the way to make ourselves better ultimately, and not get distracted by trying to intervene and trying to pull things apart too much, and the negative consequences that can have, because then the athlete's mind is distracted. It's not working on its process. I mean, sometimes athletes can plateau for 2 years, or more, but you still got to keep on the basic process.
Yeah, I thought initially when you were telling that tale, Joel, I thought you were talking about a coach whispering that to one of your athletes. I thought there was some sort of sabotage going on, because that, you can imagine that would be exactly that. It'd be very disabling for that person in what might be a crucial time. And if I'm certainly I'd be mortified if that does happen, but it would be.
Joel's athletes have minds like a fork.
I don't doubt. Now, we want to therefore talk a little on. Well, actually, I just want to hover on beliefs for a second. I mean, it's something that's come up in a number of podcasts, and a particularly useful one here is beliefs can be sort of medically instilled and physio instilled. But I just wondered what the ratio was with athletes coming into the team. How many are these sort of biomechanical or medical belief systems that really limit people's progress compared to other ones that are distant from that? So the comparison being, someone having an underlying belief of a weak core, do you find that more commonly than someone feeling like, you ask them, why do you think you get injured all the time? Why do you think that is? And they say something way out there, so I'm cursed, or there's something spiritually against me, or something else that's further from our field. I'm just wondering, I almost doubt it's always these medical beliefs.
No, I think that's actually right. I mean, in my kind of business as an independent coach, I guess in any coaching to some degree, I mean, ultimately we're kind of change agents. So people come to us, athletes come to us when they want to change something, which not always, but often implies that something has not been working to their satisfaction, or they've not seen the results they want. So we typically get two kinds of athletes: ones that have just been really broken, they've been injured, they've been ill, they've been really underperforming, and clearly that's been a major contributing factor. And then there's others that don't have that baggage of medical history or injuries. So those ones are different. So the ones that come in with these beliefs about injuries, about, that have had, we've just had some very broken athletes, holistically broken, mentally, physically, they may come in with some injuries, and it can be very difficult to overcome that depending how long they've been in that state. And, where does it come from, the beliefs? Well, some of it, so typically, my opinion, why they get that way is because of poor training methodology. Maybe it'd be obvious, coming from a coach, that's how I'd see it. But really, just in the simple way of thinking about overloading, they've just overloaded tissues. They've got injured. That's why they've got injured. They've not got injured because they have substandard biomechanics or ways of moving or patterns. That might lower the threshold by which they get injured, but they get injured because of overloading. And then the medical beliefs that they have usually involve some sort of therapy that they think that they need, or some sort of intervention that they think that they need. And sometimes there's something to it, particularly with, you might get, we've got a South African in our group called Rich Murray, and he kind of knows that if he does some gym exercise for the lower legs, he seems to ward off a certain pattern of overuse or weakness, and it doesn't take much, but if he does that, he seems to ward off these kind of niggles, and that's fine. There's no issue with that. It's easy to implement in the program, whether it's true or not. Almost it's irrelevant in some respect because it's easy to do. It doesn't interfere, and we have some evidence whether he has these kind of patterns of lower leg issues, and he doesn't if he does that. So that's fine. Then there's others that think that they need a particular kind of therapy, and I've seen everything under the sun, from acupuncturing to dry needling to MAT therapy to who knows. It ranges, and there's some athletes that come in at some point, they're, particularly ones that have had stubborn long-term issues where they really believe that they need some sort of serious intervention, and they just don't have the patience to go through, and often that might be some sort of surgery or scope, or they want somebody to go in there, and we've seen the prevalence of certain kind of injuries that or conditions or patterns that lend themselves to this. And as the scanning technology has improved, we've seen more labrum tears and surgeries associated, for example, just as one example. And not being a physio, not being a professional in this environment, but studying a little bit, talking with Paul and many others, I think the jury is out on whether there's actually this many people that have this labral problem, whether there's pain is actually associated with what they're seeing on these high resolution scans, for example. So if an athlete comes in thinking that this is the answer, this is the solution, but that's a very serious thing to go about, and it has consequences. You don't just cut somebody open and expect everything will be okay afterwards. And I've known a number of athletes, obviously, each one being an anecdote in itself, of who have ultimately succumbed to the surgery. Not necessarily labrum, but any sort of surgery, Achilles surgery, for example, that didn't have the outcome that they wanted, and then they may actually be irreversibly changed from that intervention, for example. So the belief that they need this kind of thing, and it's very powerful. That is, if you go see a surgeon and they tell you need this surgery, it's difficult for the rest of us to go against that. And in the high performance environment, you see that a lot in the big money sports, especially. They're quick to go under the knife without necessarily the patience to build strength, to let time take its course, to do the loading that is more and more seemingly the right way for a lot of injuries to heal. So those kind of medical beliefs, coming into an environment can be very difficult to overcome. I mean, I believe you can, given time, but the elite sporting environment, it doesn't always give you time, either from the athletes or outside influences. And back to the previous point, the athlete that was told this by the coach, but the potential limp, wasn't an athlete of mine, but it's something that we face because, of course, these athletes, we don't and shouldn't control all of their inputs. There's all sorts of people, especially top level athletes. People come out of the woodwork to give advice. Always, there's people, unsolicited advice. I remember Mario getting an email from somebody he never heard of before that had a detailed breakdown of his biomechanical and a running form, and they'd never heard of this guy before. But this person obviously sent a lot of work on this. And I remember talking to him briefly about it, just like, delete it. We don't need to know any of this stuff. And just the potential nature of that, it happens all the time. Everyone wants to get involved. They want to help without understanding the bigger context or the impact of their words. And
it wasn't me. It wasn't me, was it? I sort of. I thought I hadn't got a reply on that one.
But that's sorry to butt in, but mine and Joel's role with the team is bullshit filters, basically. That so much stuff is bombarding these athletes all the time, and for us it's like, to be that filter it through and most of it and chuck out to protect the athletes, and explain to them why that won't be helpful, or as with that one, no, just get rid of it. We just need to stay on the program, stay on the target, as it were.
And one of the things, Paul, with beliefs that I wanted to try and bring you in on is, I remember, and it's a while back, so I remember first chatting with you and feeling like, I was chatting to an elite sport physio working in high performance with some top athletes, and I remember saying, what thank you for your kind words regarding physio matters, but what are you most enjoying? And without me finishing my sentence, I remember you saying you enjoyed the episode with Dr. Richard Bennett, and I'm not for a minute suggesting I was surprised because it wasn't a brilliant episode. I was pleased with that, as was Richard, and it was a great overview. But it was just sort of the things that we'd done some work with about in and around elite sport, that my naivety made me think that might be more applicable. But getting to know you more, your sort of involvement with how to influence beliefs and understanding psychology and getting to those deeper, more meaningful, ingrained things. So where have you got anything more to sort of add around the psychological belief systems and things that aren't always associated to medical stuff? One
of my things I always try and instill in other physios that I mentor is to maintain that empathy with the patient. I think as Joel said before, you get physios who, this is how you should be doing things, this dogmatic sort of, you need to reach for this, physiotherapy utopia. You need to move like this and do all this stuff I say. If you don't, then you will get injured. Or we need as physios to be able to see the world through the eyes of the athlete. Not put our own mind in the athletes and say, oh yeah, I think this, so the athlete must think that as well. I think that is, some physios have got this. As a coach, that's I guess how I learned to do that. As a coach, you need to see what the athlete is seeing, and that's one of the reasons. And me and Joel have this discussion. That's why we discuss each individual athlete. Psychoanalyze them, so we know why they behave, why they do, how they perform, why they do, and why they have pain, why they do. Pain being the big topic of physiotherapy today and the world today, the growing chronic pain. I think what we've done with the team is to normalize pain. If someone's got a niggle or a bit of an ache, my first thing, okay, you do your normal assessment, you clear the red flags, all that kind of thing, but then you normalize pain. I mean, I saw another amateur athlete, and he came to me because he was waking up in the morning. He started running. He was waking up in the morning, and Achilles were a bit stiff, and my way of treating him was like, well, that's normal. And, the athletes, the guys I work with, they wake up every morning and hobble to the bathroom like old men, but they don't worry about it. That's all part of the process of becoming better athletes, becoming better people, becoming essentially more robust, less fragile. This amateur athlete I saw was, displaying signs of fragility, and I could have, told him to wear a pair of Crocs, or you need to have some acupuncture or this kind of stuff. But you just normalize that situation, tell him it's okay, and he stops hobbling so much, it becomes less of an issue. And so it's we live in the society today where we should never be in pain. Pain is the bad thing. We should live a life. And the more we try and stop being in pain, the more pain takes hold of us. And that's why both me and Joel try and limit, classic pain relief interventions. I think when I first got back to the UK, I was, from what I saw, physiotherapy, it had become this sort of, physiotherapy existed as pain relief. You might beg to differ, Jack, but that's what I saw happening. Like, someone comes in with pain, let's try and take that person's pain away. Whereas similar thing in New Zealand. In New Zealand, I was working. It was all more active therapy, getting out in the workplace, getting them out on the sports fields, doing stuff, and that's how physios would work, rather than just working on that mind to normalise things and get things back to normal, rather than just being there just as a form of pain relief.
Yeah, to bring you back in on this, Joel, one of the things that I wonder about is, in a world of this perception of marginal gains theory just being the be all and end all, the obsession with niggles and pain and trying to iron things out and aim for physio utopia or biomechanical utopia, is it a bit of a myth then that these niggles might be one of those marginal gains that will limit someone getting that medal? Because you can clearly proven it, I suppose.
Yeah, I mean, the whole marginal gains thing sells well, but the reality is doing the basics well is why athletes are successful or when they're not. And the basics being, primarily, being consistent training over time. And what can stop that is, of course, injury and illness are the biggest things that stop that. But there is definitely a trend that I try to push back against of quantifying everything and having all of this data and really trying to be perfect, if you like. You kind of alluded to, well, if we just eliminate these niggles here and there, then everything will be better, when in fact that's part of the process of getting stronger. We add stress, we adapt, and when we've seen that go in the other direction, sort of against, for example, anti-inflammatories against inflammation interventions, as an example, that actually some of these interventions may be blunting our response to training, which is interesting. We're trying to do what we think the right thing is, and we may actually be getting in our own way. And particularly, I think the reason I object to some degree also to the marginal gains talk and philosophy is it sort of feels, I think, for a lot of athletes out of reach. And if you've got to have this big budget to do all this fancy stuff, you've got your bed that you're traveling all over the world with, and your super hygienic air filters and all this stuff, and just the average athlete doesn't have access to this, and not all elite athletes have access to this. And these things are not the core of what makes people successful. And in fact, some of them may help, but I think actually the full phrase there, the aggregation of marginal gains, it doesn't actually work in that same way. You don't add a bunch of 1%ers and you get 10%. Interestingly enough, you add them all up, and they actually, in aggregation, seem to have about the same effect as any one might, which kind of tells you perhaps it's actually more about belief there, coming back to that one. But really, I think keeping it simple is really valuable, and that's within the grasp of anybody. Whether you've got your own physio on your beck and call, or whether you go see one when you've got a problem. keeping things simple, everyone can do that. Learning how to manage yourself, everybody can do that. Learning how to make good decisions about loading, everybody can do that. Not becoming dependent on, expensive or complicated interventions. Again, we can do that. I mean, sometimes see pictures of other camps, and all the athletes have got, compression pants and all of this business on, and they're sat in ice baths, and we don't really have any of that, and I don't really think it makes much difference. And I think, often it's, you might build in a bit of quiet time when you're doing some of those things, which can be useful. You go sit by yourself and don't move with a book for an hour while you're using your compression pants. Maybe it's actually the sat there part that makes the difference, versus running around and doing something like some of the athletes are doing. So, I think that's actually kind of a feel-good message anyway, though, that you don't need this complexity, and that's not where performance comes from, and it's not where health comes from. And, again, kind of tying into a lot of the stuff that Paul said, the theme of perhaps our discussion, belief, the belief that your body is adaptable, it can heal itself, that you're capable of managing yourself. And doesn't mean, of course, you shouldn't get help, etc., but, kind of empowering yourself as an athlete. And that's a big principle of the way that we work. I mean, I always, tell and behave in a way that the athletes are empowered to make decisions about where they're at, what they can handle, what's enough, what's too much. And I try to teach them how to do that on their own, because, of course, we can see, and as Paul said, we observe constantly, but we can't quite feel the way that they can. Sometimes we can catch what's happening before they consciously think about it too much. If we can see the form breaking down, or they're very fatigued, and clearly that's affecting the way that they're moving. But we can't necessarily feel, pain coming on or compensation. We can't feel it the way. So we've got to work together with athletes on that and be able to communicate. And the expression, we can, coaches or physios can see but can't feel. Athletes can feel but can't see. So we got to meet in the middle there to figure that out, but the athletes got to be empowered to do that, and I think it's a very positive message.
Yeah, I mean, might your critics suggest that this is a belief in itself? So your suggestion that beliefs matter, and I'm not for a second going to disagree with that, but then your beliefs within the lack of tinkering and the keeping it simple and the adaptive sort of philosophy that you guys have got, which again I can't find myself disagreeing with, but for trying to be devil's advocate. But there's then the thing that might get thrown back at you is one regarding evidence. Now, is the evidence of your success the only evidence yours and your athletes need? Is that sort of, am I walking into the right answer there?
I mean, to some degree, of course, how do we measure success in sport? Well, yeah, then there's the outcomes, but of course not everyone's you're not always gonna have the raw material to win everything. So I like to see individual progression and individual improvement. And, when we're talking about the efficacy of health interventions and beliefs around how to keep athletes structurally intact and moving forward, well, I mean, there's some kind of evidence there. I mean, we all in sport and physio are tracking this now. Whether we use a stoplight system or whatnot of simply taking notes. We've got a spreadsheet with every notes from every physio treatment the athletes have, and we keep track of all this, and we want to have as little interruptions as possible. I was thinking before we got on here. I think we've got 13 athletes in the squad this year, and I can't think of any actually this year that have had any sort of chronic injury that's perhaps lasted longer than a few days, or any kind of injury that's lasted longer than a few days, meaning that they had to unload from one of the sports for any more than a few days, and that doesn't happen every year. I mean, last year we had a stress fracture in a foot at one point. And we had actually 2 kind of acute injuries caused by crashes that ended up being a pelvic stress fracture in both cases, but perhaps a little bit different than chronic injury or from training, but equally those had to be managed. However, so I think from that point of view, I'm thinking this year we've had so few. Actually, that's rare, but that's actually a really good indicator of that we must be getting the training load right, the loading right, so that we're not getting these breakdowns. And that comes from good athlete feedback communication. It comes from accurate enough initial programming and then modification as required, so not being afraid to change the loading when we need to. And good maintenance and physio and all of the other elements that help us keep doing that. So from some perspective, I mean, there is evidence there, but you're right in the sense that it is a belief. This is a way of operating, which is kind of low intervention, high self-efficacy, that they can manage themselves, they can heal themselves, and that in itself probably leads to fewer injuries. So if that's the outcome, then fantastic. And the good thing is it's cheap and accessible. It's correct. It is a belief system.
But I mean, that's the thing. A belief system doesn't necessarily. We're not railing against belief as if all beliefs are bad. Of course they're not. But Paul, I know that I've seen it with my own eyes on Twitter and elsewhere as to people have suggested that your keep it simple message is as dogmatic as those that rail against it. It's what's your take on that?
I mean, I think the evidence, we do know that training works. That the evidence would back that up. Is that if you train, you improve. We do know that. And that is what the team focuses on, day in, day out. If anyone came to observe the team, that's what they would see. 7 days a week, what is it, 2 weeks off a year, probably, of active recovery. There's not particularly a great deal of off season, but, they're training. With regards to things like the 1% gains, marginal gains, as Joel said, that doesn't happen that much. Amateurs think that that's what high performance sport do. It's all about the marginal gains, and this is an issue I have, and trying to enforce the keep it simple to amateur athletes as well. They ask me how can I get faster running? Should I go to Pilates? Should I try these compression pants? Should I try these new supplements? Should I try this? Should I try this? Like, well, how often are you running a week? Well, twice a week, but I had to drop the other session because I had to do my yoga and this. Well, okay, we know that running makes you fitter and faster at running. So as long as it's within your physical capabilities, let's stop doing yoga and run. That's keeping it simple and ultimately giving the results that amateur athlete, or as well that high performance athlete wants, in that they want to get faster. And evidence would suggest also that as long as if you can maintain that degree of load, so that's why the athletes train all year round, then you're going to reduce your injury rates. It's keeping that constant loading. If the loading comes down too much, then potentially they become more susceptible to injury. And that's the role that physio working with the coach has. If an athlete is complaining of something, it's talking to the coach. Can we regress here a little bit for a day or two, or do something different? And, that constant, I guess, constant tinkering of the load if necessary. But, we don't tinker with other stuff.
Yeah, I think in conversation, we've touched on so many of the questions in which we'd sort of laid out, which is brilliant. And I hope you guys don't mind that we've gone a little off script, but it's all overlapping. Now, one question that we haven't, though, is, Paul, whilst you weren't the first to be musing about the crisp lines between philosophy and physiotherapy, you were the first to mention them on air, which was with us back in 2014. Now, in a time in which Louis van Gaal has overused and overabused the word philosophy in sport, what do you feel that your depth of understanding in wider issues brings you up to your role as a physio working in high performance sport? Because I do know you have an interest in those things.
Yeah, I mean, I think it's, what I discussed earlier with empathy. It's knowing the person, knowing the athlete, understanding why that person is experiencing what they're feeling at the moment.
But do you I suppose what I wanted to then poke into is, do you think that is something that, say, a physio that wasn't in the position in which you can live, eat, sleep, breathe it with the athlete, right? So I can completely get that. And again, I'm looking forward to disagreeing with you, but I can't. So I get that. But then, so let's say if I was to treat one of your athletes, do you think I've got the capacity in which I can try to tap into some of these principles if I was to be consulting with them? And I'll even say I had a long appointment. I'm not saying do it in 10 minutes. I mean, if I had the chance or time, could I get to know this other human to help them in anywhere near that level that you're describing?
Yeah, I mean, that's where the subjective comes from. And most of my assessments these days are a subjective assessment when I, talk and find out about the patient, their background, their culture, because then you start to get what their beliefs and what they're coming from. That can take a time and a few more sessions to get everything, or to get as much information as you can. But yes, just from one subjective assessment, you can get those I find I read these, and Joel would agree with me on this, these convoluted physiotherapy objective assessments where everything is written down there, down to, hallux, first ray, valgus, and they've looked at everything objective, but the subjective is very minimal, and lots of irrelevant objective stuff, which is just like, well, you've got all these objective findings which are relevant to this person and his experience of pain. Why aren't you finding about that person? So my advice would be to physios, find out about that person first, and then you get the clues of why they're feeling pain. Is it an athlete who's coming, to the end of their career? What's their feelings about that career? I offer that because that's, if an athlete is coming to me with an injury and it coincides with a end of career, I mean, they will tell you, of course, I want to continue a career. I want to go to the next Olympics. But I know that probably they might be saying that, but their other psychological side is probably finding a way out, and then often a pain or an injury is a way out of not competing the high pressure, high performance sport that is placed on these.
Good example. Now, Joel, have you anything to add on that? And because I'd love to sort of drag in the word philosophy there, because we've talked in and around your team's sort of philosophy on it, but do you have any other take on how maybe to best help the listeners that are wanting to try and tap into what we're describing, but aren't able to do so quite as full time?
Yeah, when you were first asking the question, I was thinking, like how could you or someone else help work with the athletes in the way that Paul does? And it made me think it would be the same question or answer that could another coach come in and be able to work effectively in this environment? And the first thing I would suggest to somebody doing that is just observe at first. Don't try to change or do anything, actually. And that's just very counter to somebody. I think that the common way of thinking is like, you got to come in and do something. And the first thing is like, just observe, just watch, see what's happening, see what you pick up. What is the body language like? What is the way of moving? Watch the warm-ups. Watch the main work part of the session. Just watch. Don't try to do anything at first. Do that for a little while, and then see pull your thoughts together, pull your observation together. And that's the same process that I use when I go start working with any new athlete. So it's the same thing, but I always would say that that's what came to me when you were describing that. For a physio, so if we have a new physio come in, it'd be the same thing. Let's just watch. So what do you see? Tell me what you see. Don't tell the athlete right away, but what do you think you see? And then, what do we do with that information? It isn't always doing something, intervening right away, even though that might be our desire. We want to be useful, we want to make a difference, but what we choose to say and what we choose to do is really important to whether whatever we're going to do is actually going to be useful, is actually going to be helpful or neutral, or maybe even harmful if we try to go in without fully understanding the context of what's going on, what's happening. Getting to know the athlete, getting to know them as a person. What pre-existing beliefs do they have, as Paul said? Particularly in the physio world, you got to kind of know what they think. Because if you come on sort of too strong with this, don't worry, your body's going to heal itself way of thinking, or don't worry, we're not going to jump, right down your throat and fix this, because usually we can't anyway. But if they have a pre-existing belief that you can do that and you don't, sometimes you don't connect right away. It can be harder work. So you've got to know what they believe. But yeah, that idea that you don't have to intervene right away. Just observe, take it in, listen. And of course, if you're a physio working in a clinic and you see somebody for a half hour, well, it's going to take more time, but the principle is the same, and that's what we try to do. But you don't have to prove yourself in the first 5 minutes, kind of thing.
Yeah, for sure. I think that you're absolutely right. Is that there's an obligation in coaching and in physio to not just intervene, but intervene in something different, bring something novel. And not keep it simple. So I totally agree with that. As you mentioned earlier, guys, the injury reduction rate, injury prevention rate at JFT Racing is exemplary, but they do rear their heads at times. So I wondered, could you describe for me and the listeners how you'd approach acute injury management as a team? We've sort of talked a little bit about prevention and things, but I'm interested when they do crop up, what's the drill? Yeah.
First thing, I'm sure Paul would agree, is don't panic. It's the very first thing, is particularly in an elite environment like ours, particularly when there's events like the Olympic Games coming up, the athletes quickly become obsessed with any kind of difference, niggles, tightness, pain, on and off, anything, they can become obsessed about it. So we try to normalize that. We try to minimize it in the sense of, even if we think it could be something more serious, we've got to, in a way, kind of downplay it or normalize it, because it is true. This is normal, right? You get these pains that come and go. But in the case that we've actually identified something, the first thing we might do is modify the training load a little bit to accommodate for that. And often that's enough. If you take away a little bit of loading, but not too much, not at all, then it might pass in itself. Looking for maybe this question that Paul should be answering, but as I'm going anyway, looking for, what might the causes be? The classic stuff that we get are actually really simple. It's like, I forgot to change my running shoes and they're just beat up from running on rocky trails all the time. Right, change the shoes. There might be something obvious like that, that we look for. Somebody's bike cleats on their shoes are broken or worn in. Who knows? There might be something like that. Often with these guys, they might be tinkering with something that we didn't know. They were fiddling with their saddle height or fiddling with the cleat placement or something like that you find out later. So we do a little analysis on that. But the
answers are often there. The reason why they get injured, the answers are often there, and I think people do tend to try and look into things too deeply or too technically, but normally it's pretty straightforward to find the answers.
Just that they've been training consistently, then, over time, then we know that there's not something fundamentally wrong. We've just managed to overload them a little bit. So we, the first thing is, back off a little bit. But we try to avoid complete unloading, and that's maybe a philosophical philosophy issue there of like, we know our body responds to load, and often we take away load and things actually don't improve how we expect. So we got to keep some sort of loading. We don't want to lose our adaptation as much as possible, and or that may actually be the solution. And Paul, you were saying before about the 2 weeks a year we typically like take off. What is the period where we actually have the most niggle or injury issues? Is often the athlete for some reason took too long off of running, and then they start running again and they've got some sort of problem. So it's actually due to the unloading in that case. Classic, that's usually the biggest period, and then they settle into training, they're fine. But coming back to sort of like that acute phase, it's just analysis, slight unloading, slight modification. We see where that goes. It's usually a matter of time. It's not necessarily a jumping with a bunch of interventions other than just that kind of modification, manipulation. And as Paul said, the answer is usually in front of us. We overdid it in one thing or the other, or there was some acute thing that happened. They've twisted their ankle, they fell over. There may be some other cause. I mean, those are as common as any. Is somebody who's running through the woods and they tripped, and they landed awkwardly, and then there's actually nothing like biomechanically wrong there, but they've just damaged some tissues, and we just actually have to give it time. And then probably the most important thing is, well, then what do we do then? And what we don't do is like rush back to the higher training load stuff, or only try to do, for example, in sport, we don't try to do the high intensity sessions first. I mean, that's very typical, is when an athlete's missed a bit of training, they want to do the sort of quality sessions first, and we'll postpone the highest loading sessions because those are the things that are most likely to further cause problems. We tried to just lower the intensity but maintain that frequency and that loading pattern, that rhythm, and typically that gets us through most of it. But I mean, I guess the ultimate answer of how do we approach acute injury management is by manipulating the training load very early on, so that we allow the adaptation that's required to happen, so that it doesn't become an actual injury. It just manifests itself as a short-term pain or short-term tightness that then we get on top of very quickly with minimal modification, minimal interruption, before it becomes something bigger. And I've certainly learned over time that if in doubt, do a little bit less. Trust your instinct on that. We get ourselves into trouble when sort of our ego is attached to our training output, and or our confidence is attached to our training output, which might seem kind of counterintuitive. But of course, we don't win races because we've had the best training ever. We win races because we've been consistent and progressive, and we actually show up at the race ready to race. Which is not, they're not linked completely, and many athletes and coaches actually don't ever really figure that out. They don't have the benefit of making as many mistakes as I've had. What I often say, the biggest mistakes I've made in my coaching is not trusting myself or my instincts when I knew that a loading session was too much and I let the athlete do it anyway and then regret it later, or didn't put limits on training load. It's very easy to just let the load go a bit higher. Load, or in another way of putting it, letting the speed or quality be more than it needs to be. The adaptation doesn't come always from the sort of the maximal load that you can handle. There's kind of a sweet spot, when it's a range. It's not, always a precise thing. If you're on the bike, there's a range in watts that's going to produce some sort of physiological adaptation, and just being in that range is going to give you the adaptation, not necessarily always at the maximum level of that. And it's the same with, I suppose, with anything, whether you're in the gym or running or swimming. There's some sort of load that's the maximum, and we don't need to be there. And in fact, that's not where our success should come from, and it's not where our athletes should think that they need to have their best ever training sessions in order to be successful. In fact, that's often when they're having their best ever training sessions, lifetime best, then you've got to be really careful, because that's usually when things go wrong.
Don't leave your race on the track.
That's right.
I've got a couple of things that are what I'm going to call potential concerns that I have, that I wonder if they creep in, and they might just be really bad guesses. But because of the very almost the liberal and cohesive attitude that you guys have within camp by the sound of things, does that mean that sometimes the athletes will do what you described and they'll be so free and so open and so they'll be put under less microscopes than they would do under other more traditional systems, if we call it that? Does that mean that they sometimes tinker and play around too much with other variables? Do they think, there might be, I imagine, other athletes in other services and teams might never dream of touching their own bike because it doesn't feel like it's possessive to them, whereas your athletes, I imagine, are very much in charge of those things. They're responsible for those things. Does that mean that they play around a little sometimes?
Depends on the personality, really. I don't think you could generalize to everybody, but we do try to encourage ownership. I was talking with some athletes from another country or coaches from another country, and they were kind of lamenting that the athletes seemed to be they're so used to getting everything done for them they didn't really seem to know how to do the basics, such as, in this case we're talking about making their own travel plans, which we sort of take for granted because we've kind of got to do that. They might get some help from somebody individually in their country, back in the office somewhere of the federation, but typically they've got to manage a lot of these details on their own because they're operating outside of their national squad or their national federation. So they've got to take ownership. I think is a positive. I've definitely have some athletes that are tinkerers, but I reckon that's more to do with the individual personality than it is kind of with the freedom, if you like, of the environment we have. Because I think on the whole, that self-management is by far a positive thing, and the downside may be the if you like, the readiness to actually do that is not the same with everyone. So obviously older, more experienced senior athletes are more able to manage themselves and all the details of their career, but a young athlete will have to learn how to do that, and of course our job is to help them do that while as making as few mistakes as possible along the way, or avoidable mistakes. Of course, there is the principle of you learn the best through your mistakes, but we want to avoid catastrophic mistakes.
Of course, yeah. And then the other thing I'm going to ask, and I'll throw this one out to Paul. The other concern I have is the concept of holistic care and the sort of everything matters and the person-centered approach. It sounds like that could veer itself into the alternative medicine fraternity, and it almost gets a bit too wishy-washy, too out there, because there's a fine line, I guess. And whilst I know that is not your style, and we've talked a little bit about that, but is there ever a worry that it digresses towards something too woolly?
I guess some people think of holism and then think of, it's homeopathy and all that kind of stuff, and looking at which it isn't, and interventionalist, as in traditionally interventionalist. As our philosophy is, talking about philosophy again, we don't even like to discuss injury as such. It's an adaptive change.
Do you use the words injury, guys?
I try to avoid it. Even a stress fracture is an adaptive change. The bone's trying to make itself stronger. We see all the stress fractures normally in the young swimmers who have got, paper thin bones, and they start running and they start to get stress fracture because the bone is trying to adapt and become stronger, but because of the overload in it, can't do that in time, and it develops into a stress fracture. So the terms I would use is that not with regard to stress, but any sort of ache or pain the athlete comes to me, it's feeling a bit sensitive, it is feeling a bit tired, the muscles are fatigued. I go along those lines before I use the term injury.
Yeah, for sure. What I then, it brings me on to something that I really need to ask Paul with regards to what then, how does this bridge on to any passive modalities that you would entertain? So we know famously you're not one for coloured tape, right? We get that. However, I know that you're not shy necessarily to, when appropriate and under the right context, to lay hands. And so where do those things fit in with you guys? So I'll go to you first, Paul, and then I'm interested to where things like ice baths or how how it all maps onto a normal schedule with Joel. So Paul first, if you don't mind.
Yeah, so an athlete will come to me with a sore knee, for example, then I would put my hands on them for various reasons, but it reassures them. They're coming to me with that painful knee. I'm going to put my hands on them and show them, therefore, that it isn't that painful, desensitize them automatically. And then I might do some mobilizations with movement, move the knee up and down. The power of touch is powerful. It gives that reassurance. It's that kind of like mothering, caring sort of role. And I don't think as physios we should ever stray away from that, but use it judiciously. So that's when I will use passive treatments. I won't. I am, of the belief that I am not, putting things back into place. I'm not doing all that sort of stuff. But I am reassuring that nervous system. I'm reassuring that person that things can move, things can be touched. They're not as injured or as harmful as they are. If afterwards they are still sore and stuff, then that would lead me to believe that maybe something is a bit more serious. Possibly, then maybe we need to offload a bit more. Again, so using your hands as an assessment tool as well. What I find with, again, other interventions, if an athlete comes to me, they can't run, for example, they're struggling with the running because their knee is painful. I will lay their hands on, move the knee, desensitize it that way, see they're running, get them to do a few movements. If they will get better then, okay? If it isn't anything too serious, they will be able to go and start running again. If it's something more serious, then, no matter what, K-tape, acupuncture, homeopathy, all that kind of stuff, that isn't going to make a difference to it. And that's where what I can get annoyed with is if you see the athletes that are at the start line, that they have thrown the kitchen sink at, they're wrapped up in K-tape, they've been acupuncture beforehand, they're, sniffing their homeopathy stuff, and they just perform very badly. They limp off, they limp off, or they just have a bad race or whatever. That's the reason I avoid that. Those things aren't going to make a difference. If they really can't run, they
become like rituals, though, don't they? And I think that some people do that, don't they? But then others, it's almost like a benign ritual, especially when it comes to things like a particular type of massage or a particular favourite sweaty piece of tubey grip or whatever. It isn't always necessarily an intimate belief, is it?
And that's why, it isn't. But that's why I think, as physios, we have a duty, I think, to stop those rituals happening or prevent those rituals and not encourage those rituals. And that's what we try and do with Joel's athletes, because, the Czech athlete, when I first, encountered her, again, I observed, watched her, didn't intervene. She had all these strange rituals going on. She was always putting on K-tape, all that kind of stuff. And through encouraging her, gradually getting to know her and saying, you can perform without this. She got rid of the K-tape and she got her belief back that her body worked, and she went forward like that. But she was totally held back by all those rituals she had got herself into. She couldn't perform without it. It becomes like obsessive compulsive disorder. And a little bit of obsessive compulsive isn't harmful, but too much of it just impedes your life.
Absolutely, it's got to be ordered. So Joel, do you mind sort of elaborating on how this all maps onto any routine, or is it all training based, or do you have any room for what staunch purists would consider gimmicks?
Well, I think as kind of the previous question also was like, does any of this stuff lend itself to sort of the what the word you used, where homeopathy and that kind of that kind of holistic stuff.
Oh, sorry, sorry, the alternative.
Yeah, the alternative, and no, I mean, if anything, we're staunchly evidence based, and actually so evidence based that actually I don't believe that most of the interventions actually work, and so we don't use them because we don't believe they work. But of course, we live in the world where people are exposed to all sorts of things that are heavily marketed and sold as working, and athletes want to believe that they work. So placebo is very powerful, and we decide what is worth pushing back against and what's not. So, for example, I mentioned these like inflatable sort of compression pants that are quite popular. There are all sorts of different types of these things. They're not like harmful, but I also wouldn't encourage somebody to go spend $1,000 on a pair either, because I don't actually think they do much. And I don't want them to be carrying them around in excess baggage and etc. if they don't actually work. And so, I'm quite critical of a lot of this stuff. Does it actually do anything? Is there actually anything there? Because if we're going to integrate it in our routine, it better work, because it's not free. It costs energy, it costs focus, it costs time, and it may be in place of something else. And a lot of that time, we don't have a lot of extra time to add interventions of anything that we don't think is actually going to make a difference. Often even on just, the most simple sort of rest and sleep, that makes the biggest difference. When some of our athletes, we give them the afternoon off, what do? They don't do anything. They just sit there and don't move for a few hours, and that makes a difference. So it is very much thinking, well, what actually makes a difference here? And the athlete that Paul was talking about before, I'm pleased to say has never regressed back to those sort of beliefs of, she used to tape herself before every run session, and you'd ask her, why are you doing that? And it's like, well, I get injured, and is there any evidence that this tape is doing anything? Maybe, in fact, the tape is reinforcing her belief that she was a fragile athlete, when in fact, over time, she has showed herself that she's actually not that. And oddly enough, or not oddly, but deliberately, she actually hardly ever mentions any run problems or run pain now. And that's after almost probably a decade of believing that she was a fragile athlete. So, we kind of reinforced that she didn't need that. She didn't need that intervention. And some of the athletes, they do, rolling with foam rollers. And even that's like debatable that this is a positive thing. Sometimes it may be, in fact, negative or counterproductive.
Don't get started on foam rollers.
Exactly. Well, so again, it's like picking your battles, though, isn't it? It's like, what's neutral? What's a relatively harmful sort of passive intervention, if you like, or what actually may be, creating a dependency that's unsustainable. And that's a big thing for my program, because we essentially have limited to nil budget, so we've got to choose what we spend our money on. And in fact, if the athletes are spending their money directly in many cases, so it's not even a matter of them being funded to get a certain kind of therapy or or whatever intervention. They got to choose with their own money, so we better make sure that it's effective. And so a lot of it, what do they have? Well, they have typically two physio / massage treatments per week, every week when they're on camp, and they can access that at any other time that they need to. It's available to them, so we don't overdo it, we don't underdo it. They don't typically need a lot of that when they go off to competitions, so that they know that they can manage themselves. We know kind of massage is perhaps and even not terribly evidence-based in itself, but like Paul said, it's reassuring, it's calming for the nervous system. It's an hour of an athlete focused on their own body, on their own recovery, and that can be beneficial in itself. There may be some more, hands-on physio of feeling, tension, tightness. Sometimes the athlete's aware, sometimes it's not. Sometimes it's helping them tune in or tune out. So that's there all the time when we're on camps. But the other sort of passive stuff, we be honest, we just actually don't do a lot of it because we don't believe that there's a strong enough evidence over the opportunity cost of doing it. So again, we try to keep it as simple as possible, as sustainable as possible, and that a lot of this stuff is the athletes doing things themselves that are either helpful or neutral.
The reason I framed that question as such, I hope you both understood why, is because being almost anti-establishment to some extent and anti sort of picky laboratory sports sciencey, dare I say it means that you then simplify things, which you guys have done well, but sometimes the same thing being anti-sports science, anti-data, in that weird sort of gimmicky sense that we've talked about with machines and not enough training, can sometimes digress people to the other side of things, which is just being anti-establishment in a hippie-ish sense. So whilst that, of course, we don't need to labour that point, I want to sort of end on the fact that whilst you are staunchly evidence-based, and you would, I imagine, make cases for it being far more evidence-based than the sports sciencey tinkering. I want to just talk and labour a little bit on the point of what does that mean in terms of the political situation in which you guys exist in a space that is, and I joked as we started, you guys are considered mavericks in the fact that you don't do much of that stuff at all. I mean, I even hear that you got your athletes don't really take supplements, things like that. You're seen as being just nihilists in some extent.
Let you answer that, Joel.
Well, yeah, I don't know what to say about it other than we try to be evidence based in terms of performance, and that's what matters. And I like to say that the message is accessible. Is that effective methods don't have to be complex or expensive or out of reach of any athlete, and what resources they may have available to them, but we, as I often think, we as Paul said, that you need to have that sort of bullshit filter though in this world, because there's just so much of this pushed at you that it's difficult to unpick what is actually effective and what's not, and that's seeming increasingly the job of coaches, athletes, and physios to be able to understand what can be effective and what not. But the environment that we work in is definitely going the other direction, and it's kind of concerning on one hand, but I suppose it's good for us on the other hand. It's good for me. The more I see other teams and coaches obsessed with stuff that, in my experience, doesn't matter as much as they think it does, I suppose the better my athletes are going to perform relatively. So, there's that. But it's really interesting just seeing how the direction of the whole high performance sport industry, and sort of the pushback against the art side of coaching and the holistic side of it. It's, I suppose it's the quantified self, it's the quantified world, isn't it, where we have our ability to measure so much than we ever used to be able to. And even coming into the physio realm, that's about these scans in the medical realm, these high resolution scans that show us so much more than we could see years ago as well. And what do you do with that information? And there's a real preponderance of data without the wisdom to know what to do with it. And I suppose that's a commonality between coaching and physiotherapy.
I think, from a more physiotherapy point of view, is this like being told you need to foam roll, you need to squat like this, you need to have a core like this, you're telling you need to take these supplements. An athlete doesn't need to do anything like that. The athlete needs to train and needs to stay injury free, and I think me and Joel have worked out a way of doing that, because we have used the evidence base, simplifying it that training works and monitoring load works, and and you don't need to do any of the other stuff. Yes, sure, if a certain athlete finds some benefit from foam rolling, fair enough. But me and Joel, we're focusing on what works and what is making that athlete a better athlete, without filtering out all the other noise that is going on in there. And that is part of our roles as physios and coach. We're that noise filter, allowing that athlete to be in a clean environment in order to thrive.
I mean, that's been the mainstay of podcast 1. I mean, podcast 2 we'll do in a second, which is sort of constructing and concealing a thorough doping program. So we'll and I jest purely on the basis of it being the beauty of the keep it simple message that.
It's been an absolute pleasure to talk to you both about. Can we finish, though, by just going to Joel? How do people find out more about you? Any links that you want to direct them to? Any work that you think would be particularly interesting for our guys?
Yeah, I guess the basic sort of website that's got links to everything is joelfilliol.com. I try to post stuff on Twitter that I find interesting, lots of articles that I save for later. Usually I find the articles on Twitter, save them, pick out something that resonates with me, and then post it back to Twitter. But that's just at Joel Filliol. And I haven't done one in a little while, but we've got some podcast called Real Coaching. And we'll resume that in the near future. We'll probably do a pre and post Olympic one, and then pick it up in the off season again. But tried to have some discussions about coaching, and maybe like real physio, real coaching. There's a commonality there.
For sure. Yeah, well, we can throw you this audio, mate, if you want to chop any bits and stuff, because there's a huge interest from our end of your work, and so if there's anything that we can do as physios to better help your cause, then I hope we can. So it's been brilliant chatting to you. Now, where are people finding stuff from you? Because I remember you saying you were going to blog, and you haven't, have you?
I know.
That's not happened. So are you gonna tell any more lies, or are you just going to send them to Twitter again?
I just piggyback off other people's blog, like Meekins. So
yeah.
And I was supposed to do one for Tom as well, but that's in the
So do I, mate. I mean, I make that joke, and I've done the same. I've been getting more guest blogs, and I haven't still got one. So I only mess about. But you're on Twitter, aren't you?
Yeah, I mean, Paul Westwood at Triathlon Physio. Contact me on there. Happy to discuss anything. Again, I think from where I started as a physio all those time ago, and as a coach and as an athlete, I think the profession is in a good place. It's changing. It's changing really quickly, which is good. And just the fact that me and Joel are on here talking to you, Jack, is a step in the right direction. And wouldn't have happened in the past. Discussing these controversial issues. I think that is what has been lacking with physiotherapy in the past. It was all fairly dogmatic. There wasn't this communication going on. With the rise of social media, things are changing really quickly, and people are allowed to talk and air views. So, and from evidence from what Joel has done with his team, the power that physiotherapy can, done well, can have in injuries happen, or adaptations happen, but you can keep it down.
For sure. No, lovely. I mean, it's such a nice place to finish. Thank you so much for your time, gents. Really do appreciate it, and I hope we can do this again sometime. Hopefully, with more discussion of more success.
Yes, definitely.
Enjoyed the chat, guys. Thank you very much.
And good luck in good luck to the guys in Rio, of course.
Oh, for sure. I can't believe I missed that out. Yeah, good luck to all those guys.
Exactly.
Yeah. All right, cheers, guys. Thanks a lot.
Thank you.
And that was session 32. Massive thanks to Joel and Paul for their time, and really interesting episode. It was always bound to go on longer than it was intended. Extended commentary from me in terms of summary, available to our patrons on patreon.com, which is Patreon. And you can find us under the Physio Matters podcast on there. We'll leave some links in the show notes, and you can sign up for our newsletter at choosehealth.co.uk. Final thoughts from me, though. I really do admire the keep it simple approach, and having overcomplicated things myself in the past and then simplified things down steadily and accurately to the betterment of my practice and the betterment of my results with patients. I really do sort of find that seems to be the best way forward, and if we're going to be progressive with fanciness and gadgets, then we should do so from a good baseline, and then we can really recognize whether they're making a true difference. But the way I think about these things now is it makes so much sense, both in terms of tissue as well as neurophysiologically, that you can make a case easily for why you will get good effects by doing more, by interfering more, by tinkering more, by even whether it be interaction or anything passively or anything magical. You can make a case for why that might have an effect on performance, pain, or any other sort of outcome that you're looking for. Now, it's harder to make a case for why doing less would influence those variables. So therein lies the question for me. How much of what we do is out of obligation or out of societal expectation? I personally would walk back from an awful lot of the tinkering, the interference, and lean heavily towards reassurance, what I call liberation of movement, liberation of thought, almost even liberating people's worries and concerns. You'll let them out, let's talk about them, let's try and see which are reasonable, which might not be quite accurate. They're still reasonable to that person, but are they founded in sense? Are they founded in science? Are they founded in myths? Are they things that we can unpick? But that can include movement, that can include people's confidence in the way in which they do things or how they do things. But liberating movement and liberating ideas is hard to do when you're interfering to such a level. And I keep using this word tinkering. I'm sure I did it in the interview, but I hope that you guys understand what I mean when I say that there's a huge difference there, and it's very difficult to liberate people when you are posing authority on them, which is a fundamental mistake, I feel, of our profession, as well as, of course, those around us. We're not the worst for it, but we're certainly not the best either. And I think we need to have a serious think about what Joel was saying, and to some degree what Paul was saying about the way in which coaches perceive us, and the way in which those that are doing this work in performance are looking on and seeing us as being unhelpful interferers at times. That's not okay. And it needs to be corrected to some degree. And even if let's just say those that are doing the tinkering, those that are making people statistics, those that are making people lab rats, let's say they're even right. Yeah? I don't think they are. But if they are, if that comes out, if that's the way that things go, if that's the direction that the science takes me, you, and everyone else, then we still have a job to do to marry the relationship, to improve that communication between the different disciplines. And so whilst that's going on, no matter who's in the right or in the wrong or who's on the right lines, whilst we can I would propose that these guys are, but regardless, we need to heal some of these things, particularly in difficult and turbulent times in sport and in health and elsewhere. So a little food for thought from me to finish. And follow me on Twitter at choose_health, the Physio Matters podcast team, or at TPM podcast. Then you've got at Joel Filliol and at Triathlon Physio to get our today's podcast guests, who, again, we thank massively. Thank you to those who've already joined us on Patreon, and I hope that a few more of you will catch along for some of the more exclusive content that we're pushing out through our new channel. So that leaves me to say, you've been listening to the Physio Matters podcast, discussing physio matters because physio matters. Bye for now.